Welcome to part 1 of nursing practice questions and answers about respiratory problems of the adult gland. Now let's start with the first question. The emergency department nurse is assessing a gland who has sustained a blunt injury to the chest wall. Which finding indicates the presence of a pneumothorax in this gland? So these are the options. Option A, a low respiratory rate. Option B, diminished breath sounds. Option C, the presence of a barrel chest. Option D, a sucking sound at the site of injury. Now for this question, the correct answer is option B, diminished breath sounds. Now let's move to the rationale. This gland has sustained a blunt or closed chest injury. Basic symptoms of a closed pneumothorax are shortness of breath and chest pain. A larger pneumothorax may cause tachypnea, cyanosis, diminished breath sounds, and subcutaneous emphysema. Hyperresonance also may occur on the affected side. A sucking sound at the site of injury will be noted with an open chest injury. Now let's move to the second question. The nurse is caring for a client hospitalized with acute exacerbation of chronic obstructive pulmonary disease, COPD. Which findings would the nurse expect to note on assessment of this client? Select all that apply. So these are the options. Option A, a low arterial partial pressure of carbon dioxide level. Option B, a hyperinflated chest noted on the chest X-ray. Option C, decreased oxygen saturation with mild exercise. Option D, a widened diaphragm noted on chest X-ray. Option E, pulmonary function test that demonstrate increased vital capacity. The correct answer for this question is option B, a hyperinflated chest noted on the chest X-ray, and option C, decreased oxygen saturation with mild exercise. Now let's move to the rationale. Clinical manifestations of chronic obstructive pulmonary disease, COPD, include hypoxemia, hypercapnia, dyspnea on exertion and at rest, oxygen desaturation with exercise, and the use of accessory muscles of respiration. Chest X-rays reveal a hyperinflated chest and a flattened diaphragm if the disease is advanced. Pulmonary function test will demonstrate decreased vital capacity. Now let's move to the third question. The nurse is preparing a list of home care instructions for a client who has been hospitalized and treated for tuberculosis. Which instruction would the nurse include on the list? Select all that apply. So these are the options. Option A, activities should be resumed gradually. Option B, avoid contact with other individuals except family members for at least 6 months. Option C, a sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. Option D, respiratory isolation is not necessary because family members already have been exposed. Option E, cover the mouth and nose when coughing or sneezing and put used tissues in plastic bags. Option F, When one sputum culture is negative, the gland is no longer considered infectious and usually can return to former employment. Now for this question, the correct answer is option A, activities should be resumed gradually. Option C, a sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. Option D, respiratory isolation is not necessary because family members already have been exposed. And finally, option E, cover the mouth and nose when coughing or sneezing and put used tissues in a plastic bag. Now let's move to the rationale. The nurse will provide the clan and family with information about tuberculosis and allay concerns about the contagious aspect of the infection. The clan needs to follow the medication regimen exactly as prescribed and always have a supply of the medication on hand. Side and adverse effects of the medication and ways of minimizing them to ensure compliance need to be explained. After 2 to 3 weeks of medication therapy, it is unlikely that the clan will infect anyone. So activities need to be resumed gradually, and a well-balanced diet that is rich in iron, protein, and vitamin C to promote healing and prevent recurrence of infection needs to be consumed. Respiratory isolation is not necessary because family members already have been exposed. So instruct the client about thorough hand washing, to cover the mouth and nose when coughing or sneezing, and to put used tissues into plastic bags. A sputum culture is needed every 2 to 4 weeks once medication therapy is initiated. Finally, when the results of 3 sputum cultures are negative, the gland is no longer considered infectious and can usually return to former employment. In my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.